This presentation is for the FSCJ BSN program, Community Health course. Our topic is prison nurses. Participants are Michelle Boyd, Cynthia Campbell, Yoko Mitsushima, and Todd Wimberly. Just a general definition, overview, prison nurses are nurses who take care of patients that are incarcerated, either in jails or in prison settings. This population and this type of treatment is often not seen or known about by the general public. So that's why we thought it'd be a good idea to educate and inform you today.
The primary nursing activities include medication administration, monitoring patients, and performing any type of treatments that are ordered from the physicians, which could include doing blood work, dressing changes, administering blood, catheterizations. You're going to be charting and assessing patients, which is the standard procedures, monitoring for any changes in vital signs, coordinating care, different disciplines, which can include specialists, case managers, dietary, pharmacy, laboratories. You want to teach and educate patients about their care, and you want to also advocate on their behalf. Also, you want to document and record patient vitals. Okay, you want to teach and educate patients how to be autonomous and advocate for them to mainly take care of themselves, be proactive instead of reactive. The specifics in correctional nursing is going to be trying to maintain confidentiality based on the environment in which your setting is in, and also secure and safety is what you want to also focus on, because in this type of environment you're dealing with patients that could be violent. Also, you're going to be aware of your instruments that you're using when you're in the facility, because you'll be having needles, sharps, and also you want to keep close contact with your keys and making sure that your med supply cabinets are locked. Scope of practice, you want to provide professional and safe care based on medical necessity for the patient, not what the correctional officers would want, such as they may want you to mace or pepper spray an inmate or help with handcuffing. That is outside of the scope of practice. Also, you want to provide care that is not to be construed with overly touching in a prison setting. You want to stay within those professional boundaries. Also, you want to provide appropriate care regardless of the criminal nature in which the inmate is in the prison for. Teaching strategies, you want to include your inmates on participating in any preventative care that is offered, such as immunizations, vaccinations. Also, you want to educate your patients on any medications that they may receive, to be aware of any side effects that they may experience, the specifics on when to seek medical care in an event of an adverse reaction.
So what do you have to do to become a prison nurse? So there are LPNs and RNs work as a prison nurse, and it depends on which one you will do, and of course you are going to have different responsibilities. As far as training, so education, usually they don't require special certification or educational program. You can just get your RN licenses, then you can go ahead and apply for a job and receive on-the-job training. There is a certification that you can get, the Certified Correctional Health Professional, CCHP that is called, and you can get this certification and increase your marketability as a correctional nursing. And there are 8 different areas for this certification test that you can, different areas that they will test, as you can see on this slide. So I guess you can sense what it takes to become a prison nurse by looking at this subject. And some interest questions that I found are, for example, how to escort the inmates and how to prevent the suicide in a cell. Or there is a question about there's a question about the Rape Elimination Act. So those things can be tested.
Okay, your prison nurses are going to interact with many of the same disciplines as a nurse who works in any other settings interact with. For instance, in an RMC in Lake Butler, there's a prison hospital. We have on-site medical surgical care, cancer center, specialists, neurology, oncology is there, nephrologists show up, and there's even an MSU, which is a mobile surgical unit, so you're going to be dealing with surgeons as well. Also, a big part of the prison population is going to have some sort of psych history, and there's mental health people there as well. You're going to deal with psychiatrists, mental health specialists, and so on. Ancillary services, just like at any other hospital, you're going to have your pharmacy, your laboratory, respiratory techs are going to be there. You know, you have patients on vents. You got to have X-ray, MRI, CT. That's all done on site. And we have dialysis center at RMC in Lake Butler. There's also a cancer center where they're going to get radiation as well as chemo treatment. You have your outpatient clinics, like their family doctor. It's an outpatient setting. They have their sick call where they can show up for wound care or for the sniffles. And then they have the emergency care, the urgent care, where people are going to come in for life-threatening injuries, ACLS and all that's going to be provided there. So you're going to be interacting with respiratory, with physicians, with EMS, and of course, you're going to have to deal with corrections. That is the biggest difference of being a prison nurse is you're going to be dealing with security in this setting. So you may have a patient with a brain bleed that needs to leave right away, but public safety comes before that inmate's medical condition, and if security doesn't have the personnel to travel with that inmate on an EMS run, he's not going anywhere. So you must coordinate with corrections along with this patient's care. Utilization management, kind of like the case managers for these prisoners, and they're the ones who coordinate and decide where an inmate is going to go. If we're having to send him out, he's going to go to Shands in Gainesville or Memorial in Jacksonville or wherever. So utilization management consists of many nurses, specialized nurses, as well as physicians who coordinate that plan of care. Social services, of course, these inmates all have family members on the outside. They all have, the ones who are not sentenced to life are going to be getting out. So social services will coordinate with these inmates and their families, their plan of care after they leave the prison system. Outside facilities, we covered that a little bit with utilization management. You're going to have your Shands outside, your Memorial, your Baptist. Wherever that inmate is going to be leaving to, we have to coordinate with the personnel there. And then they are regulated by ACA. So just like any other hospital, a prison hospital has to meet criteria of ACA just like anywhere else.
Okay, so new inmates come to jail with a whole new set of medical conditions like diabetes, hypertension, sometimes alcohol and drug addictions. So sometimes some inmates are homeless, and that can increase severity of chronic condition like mental disabilities. So at some jail, there will be no doctor 24/7 on site. So basically, nurse will call a shot. So it's very important to have a ability to implement early intervention. And of course, some inmates are pregnant. So you have to know how to care for those pregnant women. And another one is mental health issues. In 2012, there's a survey about just about 20% of inmates have a severe psychiatric history. So from acute care to women's health to mental health, you have to be diverse and exposed to all these areas as a prison nurse. And of course, it's important to have the ability to learn about their lingo so you can be aware of your surrounding and know what they are talking about, and just to know the psychological game that they might play with you, because it's important to know.
Okay, interesting facts about being a prison nurse. A lot of times when you're in the prison setting, you have to be concerned with the patient safety. Like it was mentioned earlier, you work closely with the correctional officers, so you have to be aware that you can only provide medical necessary care. You cannot just see an inmate whenever they cry that they have a bruise or a bump or a scratch. It has to be something that's medically necessary to be treated. Also, when you're a prison nurse, you're not able to show empathy in a general manner that you would if you were in a regular hospital setting. You're not allowed to touch the inmates. You're not allowed to give them hugs or, care for them in that way that you would on the outside. So you're only able to express verbally your empathy towards them. You also have to be careful about your routine supplies that you have at the bedside or when you're providing care. A lot of these routine supplies can be taken by the inmates and later made into weapons that can be used to harm themselves, others, including the nurses and the correctional staff. Caring versus safety is always a concern with them. You always have to make sure that your safety is always first and foremost, more so than caring for the patient. And that could be difficult at times because you want to care for the patient, you want them to get well, but you also have to make sure it's done in a safe setting. So you can't normally just run into the inmate's cell to take care of an emergency that's happened. You have to make sure the correctional officers are there with you to escort you in there and to be present at all times when you need help with the inmates. And that includes also going out on the campus. Sometimes you have to go out on the campuses to care for the inmate because they're not able to come to the medical building. And so at that time, you also have to be escorted out. So it could be, a lapse of time by the time you get the phone call to where you might be able to get to the inmate to provide that care.
Unique and interesting findings doing this project and learning about prison nurses. Number one, perception of prison nurses versus reality. If you do a survey of people and ask people what they think correctional nurses do, most of them will tell you they're pill line nurses, where they stand in a window, inmates come to them, they sling some pills and see them on their way. Through research and real world experience, I've found this to be very untrue. There are positions like that, pill line nurses, but that's just one piece of the puzzle. Nurses in this setting are very hands-on, and they have to deal with a wide array of different patient disease processes, as well as other things going on in the surroundings. And they do get comprehensive health care access. These inmates are denied nothing. The laws see to it that we go above and beyond in caring for these patients. The quality of care for most of them is far better than any of them would ever receive on the street. We're treating their diabetes, their cancer, their hypertension. They're getting these medications. If they need to be sent out for higher levels of care, they're getting it. They're getting the MRIs, they're getting the CTs, they're getting doctor attention. Patient rights, they're very protected in their patient rights, and they know it. A lot of these prisoners don't have anything to do other than read and learn about what rights they have. They have lawyers on the outside also informing them of their rights. So they know their rights, and their rights are very well protected. The nurse, as the patient advocate, oftentimes in the prison system, you are the only person advocating for this patient. The correctional officers are not advocating for them. The system isn't advocating for them. So as the nurse in a correctional setting, you have to go above and beyond in getting this patient the care he needs, as far as getting his voice out there and getting him what he needs. And there is a Florida hospital in Lake Butler. It's very unique. It's one of a kind throughout the states, where they have this totally encompassing hospital service provided to them. Thank you.